Good afternoon and welcome to this week's Trust-wide Briefing. My name is Gary Morgan from the Communications team. I hope you can all hear and see me okay. I'm covering for Dominic and Alison, who can't be with us this afternoon. We've got a packed agenda as always, so we'll get on quite quickly. We're going to hear from Charlotte and Linda talking to us about Callington Road first of all, and the updates around that. And then Martin from our infection control team will give an update around measles, which you may have seen in the news over the last few weeks. Christine Kapopo, our new Deputy Director of Nursing, will then talk about team objectives and how that links into the recent changes to our appraisal process. And then finally, Matthew Page, Chief Operating Officer, will do the usual ops update. So we'll get on with that. But first of all, there's a couple of things I just wanted to pick up. The first is to remind you that the annual AWP award nominations are currently open and will be for another 9 or 10 days. So I think they close at the end of next week, so 5 PM next Friday the 23rd. I think we've had 300 or so nominations so far, which is great. But there's just a few more days left for you to get those nominations in. So you can do that for another colleague, to another team. You can do it for your own team, and you can even nominate yourself. So don't miss the opportunity to do that, as I say, before the end of next week. Just a really quick practical one as well, just to benefit people who may be tuning into this for the first time, just some functionality that MS Teams allows you. So on the control panel across the top of the screen, you'll see an option which says more with just 3 dots above it. If you select that and then click the language and speech button, you'll get an option to turn on live captions, which just means that the subtitles appear on the screen as people are talking. I'm not sure if that's a good idea when I'm talking, but if that helps you and benefits you, then you've got that facility to utilise as well. As always, if you've got any questions, you feel free to use the Q&A box, which again is on the control panel at the top, and we'll try and answer those during the session or at the end. But also feel free to contact the comms team, and I'm sure the presenters are happy to be contacted directly afterwards as well, if your question isn't covered during their presentations. So without any further ado, I think we'll hand over to Charlotte Scully, who's going to talk to us about the Callington Road developments in Bristol. So Charlotte should be waiting in the wings, and I'll hand over to you, and if you give us that update, that'd be great. Thanks, Charlotte.
No problem. Hi, I'm Charlotte Scully. I'm Senior Programme Manager. I work in estates projects in the estates team. I'm here today to give you an update on the Callington Road redevelopment scheme. This is a really exciting project for the Trust. If you aren't aware of where we're doing the work, Callington Road Hospital is one of our key sites, our inpatient PQ sites in Callington Road, which is in Brislington, South Bristol. The scheme is a £10.7 million scheme. We are refurbishing, remodelling and extending quite a lot of the buildings on the site. The site was built originally in 2006 and we're adapting it to support modern healthcare for mental health. We've completed phase 1. The building works have been split into 3 phases. The first phase was Larch. Larch was an old rehabilitation ward. We've completely gutted it and we've refurbished it. We moved the therapist team that were based in Woodside over, and we handed the building over on the 6th of December. We moved the team over at the end of December, and we are operational in the building now mid-January. We've also completed a modular unit for our maintenance provider, Ryden, in the edge of the staff car park. Phase 2, we're sort of in the middle of it now. The first phase of phase 2, Lyme, we're putting a brand new place of safety suite on the end of Lyme. The area was a HDU. And we're extending it, so we're putting a new place of safety there. We started work at the beginning of December, so we're sort of midway through really, and we're going to be completing on the 23rd of July. We're also installing a brand new de-escalation suite in Lyme. Lyme is an adult acute for males. We're starting out in March and we're finishing at the same time again, 23rd of July. We're doing lots of work in Woodside, which is the main reception, and the catering kitchen. So the catering kitchen provides services for the whole site. We're currently operating at a temporary basis in Woodside, and we plan to hand over at the end of April. And we're also installing a new de-escalation suite in Silver Birch, which is an adult female adult acute ward, and we finished that on the 23rd of July. So lots of work happening on the Callington Road site. I just want to say thank you, especially to all the clinical teams and everyone based on the site that's tolerating the work at the moment. Everyone's been great to work with, and we've got lots of really good liaison with the site ward leads. So it's going really well. Phase 3 starts at the end of April, and this is where we completely gut the therapies department where Woodside where therapies were, and we're going to be moving the teams over at Southmead into this ward. It's going to be called Holly Ward, and we're going to be completing that in sort of early to mid-December with a planned move-in date of January. So the place of safety and the new adult acute ward is essentially moving Mason place of safety, which is at Southmead, and the Oakwood ward, which is on Southmead, the adult acute ward, over to Callington Road. So that's basically a sort of quick rundown of the work that we're doing on site for that project. I'd like to hand you over to, or obviously if you've got any questions as well, just pop them in the Q&A or ask. And I'd like to hand you over to Linda Holbrook, who I'm working closely with on the project, to give you a bit more information from a clinical and service perspective. Thank you.
Hi, everybody. Hello, hi. So I'm Linda Holbrook. I'm head of Bristol Inpatients. I'm sure quite a few people know me. And yes, as Charlotte says, I'm working very closely with Charlotte and the team in the development of Callington Road Hospital, which is including the 2 wards from Southmead moving over. So the way we're doing it is we have meetings in parallel with each other. So we've got Charlotte's estate meetings, and then whilst it's been phase 1 coming into phase 2 and then phase 3, we have operational stroke clinical meetings, stroke an HR meeting to really to move the services over. So the bit that I'm working on now in phase 2 is the moving over of Mason and Oakwood. In that meeting, so Sarah Pavey, modern matron, is more or less is chairing the meetings, but in these meetings we will be looking at the new operational policies, what it really means for service users. We've got service user involvement, and down to HR. So today, for our initial meeting with Oakwood, is we've got everyone together, including HR, and then we work out the timetable as when people will need to come in, because obviously, as we are moving across, there will be an HR process. Service users have been very, very involved in the move, and they helped us choose the name for both wards. Bristol Place of Safety is staying Bristol Place of Safety, but Oakwood Ward has changed to Holly Ward. So that's really quite exciting. Now the works, as you probably understood from Charlotte, they will be the place of safety building works will finish hopefully in about July, but the works to the new acute ward at Woodside will not finish until sort of December. So the wards are moving over together. So they will stay supporting each other at Southmead until we are able to move both Oakwood and Mason over to the Callington Road site. And then we have a big celebration because it is Christmas time. So everybody is looking to that, and anyone is welcome to come to that meeting. I think the most important thing is having, everybody included, hearing everyone's voices. So staff are really looking forward to the move. The wards over at Southmead, have been working really, really well, but the upkeep of the wards, people are looking forward to moving into new refurbished areas that they have been involved in designing alongside service users. So there's loads and loads of scope to discuss and think about. So if anyone has any good ideas, please say. I suppose the other thing is we need to think about the Mason unit, the place of safety, which was one of our really first multi-agency pieces of work that we do, and we work as a multi-agency team. So that is also will require more stakeholders involved, such as the A&Es, police, AMPs. So there's loads and loads of work to do. But I did that move the other way from Hazel Unit to Mason. We're moving back. So there's loads we've learned over the years as well. And we just want this to be a really good journey for service users and staff to have a fresh start in 2025. Happy to answer any questions.
Thank you for that, Charlotte and Linda. And if you can't celebrate Christmas on Hollywood, then I'm not sure where you can. So we look forward to that. Obviously, a huge amount of information there, and there is, I think, if you go onto our space and click the projects tab at the top, and you'll find Callington Road. I think there's lots more information that you can read, and we've also got a really good video. I think Charlotte and Linda star in it. Which, if it hasn't already, will be on the staff, AWP staff Facebook group. So if you're not members of that, just go onto Facebook, search AWP staff. You should be able to find that too. Okay, that's great. So moving on, I think Martin's ready. Martin Case, our lead nurse for infection control. So you may be aware of rising cases of measles, which I think has been in the West Midlands region, perhaps more predominantly, but it's certainly something we need to be sighted on and aware of. So I'll hand over to you, Martin. I think you've got some slides that we'll be sharing as well.
Yeah, thank you very much. So yeah, just a few slides to sort of help get over the points I want to in a few minutes, just to raise awareness really, and as I've put here, be aware. As Gary says, there's been quite a number of cases, mainly in the West Midlands, but also in the London area, and cases are cropping up all over the place. In the southwest, we seem to have a better immunisation rate than those two areas, but having said that, it's still way below what would give you what's called herd immunity. So all regions are at risk. So there was a case last week of measles in Bristol linked to Birmingham. So it could crop up anywhere. So be aware that the cases are increasing, and this is down to a drop in the vaccinations, unfortunately, over the last sort of 20 years or so. And I'll go through these one by one very briefly. If you could put the next slide up, please. Thank you. So just to show you how infectious it is, it really is one of the most infectious viruses we know about. So this illustrates you've got 100 people, and if they're all not protected, they're not immune, and you put one person in there with measles, then 90 of them will get measles. 9 out of 10 people will get it, which is quite extraordinary. It's probably something like 1 or 2 with COVID, for example. And out of those 90 people, the problem is 7 of those will go on to get severe complications, which can include inflammation of the brain, pneumonia, and other problems. The people most at risk of these serious complications, immunosuppressed, pregnant women, and very young children. And it's a difficult one to manage, because it's so infectious. So once you've been in a room with somebody and you're not immune, then there's a strong chance you might get it. And in that case, say it was a healthcare worker, for example, and they're not immune, we would have to put them off work for 2 weeks from sort of day 7. You can see the incubation rate I highlighted halfway down there, from 7 days to 21 days. And this is something we really want to avoid, because if we have lots and lots of people going off because they've been exposed to measles, that's going to have a very negative effect on the NHS. Obviously at AWP, we're not in the front line here. It's more sort of ED departments and children's services, but adults get it as well. But it can crop up anywhere. And as healthcare workers, we have got a responsibility. So we go on to the next slide, please. So this is, I know you can't read all this, but this is a poster that the UK HSA has issued to ED and GPs and things. And the thing is to think measles. Basically, I know we're not infectious disease experts, but somebody with a fever and a rash could well be infectious. It might not be measles, it might be something else. If you want it, and we can arrange it for you. We'd either get it for occupational health or through some of the vaccination clinics that are popping up all around the area. So we will be able to get it for you if you want it. So it is very important. You know you're in recognised status and and you've not had measles. So at the moment with the respirator masks, the FFP3 masks, they're prioritising fit testing for community teams who possibly are more at risk. But as I say, to start with, but again, Ollie, Toby and his team in the resilience can help with fit testing. If you've been fit tested in the last couple of years, we're still using the same mask. If your face is So I'll leave it there, but just to be aware this is an important thing, and we really don't want lots of people will get over it. It's not very nice, but you will get over it, but some people will be very sick with it.
That's great, thanks Martin. And as I said before, very important that we're all vigilant